Hello guys, welcome back to my YouTube channel. Welcome back to nursing channel. In this channel, if you're new here, we usually talk about nursing, lifestyle vlog, and in case anybody suggests that I speak about specific condition, I usually consider that. So in this case or today's video, I'm going to talk about sickle cell because that was what was suggested in by most of the people. So if you're new here and you've not subscribed, kindly consider doing so. And returning subscriber, thank you very much for always clicking in. Don't forget also to turn your notification bell. Don't forget to share, like, and comment anything you want to comment, so long as you keep respect or you touch your respect on your comment. So today, let us talk about sickle cell, and we are going to look at what is it, how does it come about, how can it be treated, does this sickle cell can be prevented. So those are what we are going to talk about in this specific video. So let's get into the video and make sure you watch this video up to the end so you know more, so that you know more about sickle cell. So let us define sickle cell anemia. Sickle cell anemia is a form of inherited blood disorder, sickle cell disease. Yeah? Sickle cell anemia changes your red blood cells shapes, turning round flexible disc into a stiff and sticky sickle cell that block blood flow. A long time ago, people were not able to detect a sickle cell anemia earlier, and so you get that people were dying. People were dying without even, you might get that a child was born healthy, and because there were no equipment to, or maybe there were no advanced lab to identify the disease earlier so that the person can get treatment, you find that people were dying before this even condition was detected. Nowadays, we thank the healthcare team. They are able to detect the disease before it is too late, and someone who is suffering from sickle cell can get treatment, can get prevention of crisis, and therefore these people live even up to 50s. Long time ago, they were not able even to live up to 20 years. I used to hear when people say that if you have a child or a person who is suffering from sickle cell anemia, when they reach 18 years, they will die. But nowadays that notion is not there. Our healthcare team has advanced everything, and people with sickle cell can even get transplant, bone marrow transplant, and they can live healthily without any complications. So we have said that if you have sickle cell anemia, your red blood cells is not normal. So they are not able to carry oxygen to all parts of the body as they're supposed to do. So you get that when you have sickle cell anemia, most of the time you get crisis, that is pain that is caused of lack of good supply of oxygen to some parts of the body. And also you can get other conditions because, you know, if you are some organs doesn't receive enough oxygen, you can complicate to other condition. Your lungs can be affected, your brain can be affected, your kidneys can be affected, and many organs in your body can get affected. So who is at risk? Who is affected by sickle cell? Not who is at risk. Who is affected by sickle cell anemia? So sickle cell anemia is rare in United States. That is what I can say. And we say it affects about 100,000 people. It mostly affects people who let me say it mostly affects people whose ancestry, because we say this is a inherited condition. So it affects people whose ancestry links back to part of the world where many people have malaria. and carry a genes that provides potential protection against anemia. So we get that where these sickle cells are found, these are places where malaria is endemic. Yeah, where malaria is endemic. In Kenya, we find that Western and Nyanza, those are the most people who are affected by sickle cells anemia. So these genes also causes sickle cell anemia. Yeah, the genes also causes sickle cell anemia, and in the United States, sickle cell anemia affect many people who are black. Yeah, black people are at risk of so many things. That is what they usually say. So we are getting a point here that in United States, it affects people who are black. It may also affect people from Europe, Middle East, and Asia. Yeah, those are people who they can affect. So how does sickle cell anemia affect people? Babies born with sickle cell anemia may have symptoms for several months. What am I saying? Babies born with sickle cell anemia may not have symptoms for several months. When they do, symptoms include extreme tiredness, fishiness, and also, let me say, extreme tiredness caused by anemia, and also painful swollen hands and feet. They may also suffer from jaundice, and you find that these babies may have swollen spleen and spleen damage that can affect their immune system and increase their risk for bacteria infection. Yeah, as people with sickle cell anemia grow older, they may develop different and more serious medical complications that happen when organs, tissue don't receive enough oxygen. So people with sickle cells are at risk of stroke, lung disease, kidney disease, and also spleen and liver damage. Yeah, you see, when you're having sickle cell anemia, the blood are not being transported to all parts of the body, and you know the red blood cells get stick along along the vessels, and they clog, making the organs to lack oxygen. You get that if all these organs in your body lack oxygen, what will happen? You will have multiple organ damage. Yeah, that is what can happen to you when you have sickle cells. So let's talk about signs and symptoms of sickle cell anemia. So before we talk about signs and symptoms, what causes sickle cell anemia? We find that people with sickle cell anemia inherit the disease from their biological parent. When you have a sickle cell anemia, just know one of your family member had sickle cell anemia or was a carrier. So in sickle cell anemia, the gene that help make normal red blood cells mutates. Mutates means it changes. Yeah, it changed the shape. So people who inherit the mutated hemoglobin protein gene from both biological parents have sickle cell anemia. So people who inherit the mutated gene from biological parent have sickle cell trait. What do I mean? I'm saying anybody who is suffering from sickle cell has inherited the mutated gene from the both parents. Yeah, that is what I'm trying to say. So how does this mutation affect normal red blood cells? That is what we want to look at. So we are saying normal red blood cells contain hemoglobin. Normal red blood cells contain hemoglobin. Hemoglobin is a protein and the main part, and I'm saying hemoglobin is a protein and the main part of red blood cells. So when the hemoglobin gene mutate, when it changes, it creates a sickle cells that cannot navigate the network of blood cells that carry oxygen nutrients throughout your body. Here where normal hemoglobin is soluble, meaning it dissolves in fluid. So abnormal hemoglobin is not as soluble as normal hemoglobin. Yeah, that is what I'm trying to say. And what are the signs and symptoms of medical condition linked to sickle cell anemia? So sickle cell anemia symptoms typically start when babies are 5 to 6 months, and nowadays I'm seeing someone is even diagnosed with sickle cell even when this person is 10, 11 years, 11 years and below. That is the highest years that I've seen a child is being diagnosed with sickle cell. So, but they are saying sickle cell anemia typical symptoms usually start when the baby is 5 and 6 months old. As they grow older, most people with sickle cell have increased risk of developing new medical conditions. So some of these conditions are life-threatening conditions, but by learning about conditions and symptoms, people with sickle cell anemia can seek help at first signs of trouble, so healthcare provider can treat the condition or can prevent the complications. Now, let us look at all these conditions that may set in when someone is having sickle cell anemia. Number one is vaso-inclusive crisis. Vaso-inclusive crisis. Today we are learning very difficult term. Even me, I'm shocked. So, vaso-inclusive crisis. Healthcare provider may call this condition acute pain crisis. So, acute pain crisis is the most common reason why people with sickle cell anemia go for emergency room or need to spend time in the hospitals. I want to say that symptoms include sudden intense pain because of lack of supply of oxygen to several parts of your body. The next one, pain can be sharp or stabbing. And then this condition, vaso-inclusive crisis, may affect many parts of your body, but typically it usually affects the abdomen. You might find that you are having a lot of pain on the abdomen, on the lower back, on the arms, and on the legs. So, living with this condition is one of the most difficult aspects of having sickle cell anemia. Among other symptoms and complications, people who have sickle cell anemia may feel depressed, anxious because they are dealing with a certain stigma associated with this condition. Another thing that sickle cell anemia people usually deal with is stigma and sickle cell. Let me talk about stigma and sickle cell. So I want to say that sickle cell, healthcare providers sometimes call people with this crisis invisible illness, because people who are having pain crisis may May at times don't have symptoms other than sudden intrusive pain that are not even responding to opioids and analgesics. So studies show sickle cell anemia crisis, not anemia crisis. Studies show sickle cell anemia carries a stigma linked to people's need for opioid painkiller to manage the vaso-inclusive crisis. So let us look at another condition. We have another condition that is called acute chest syndrome. Acute chest syndrome. What is it? Acute chest syndrome is the most common complication of sickle cell anemia. It is also the most cause of death and the second most common cause of hospital admission after vaso-occlusive. It happens when sickle cell clamp and clog blood vessels in your lungs. You find that you see a normal person usually have the heart usually pump blood throughout the body. Every part of your body must get blood. So you get that this blood that is sickled in shape, when it has been pumped to the lungs, it gets stuck there. It gets stuck in the blood vessels in your lung. And then you will have acute chest syndrome. And this person may have a sudden chest pain. It is not just a pain. It is severe sudden chest pain. This person may have cough, fever, and trouble in breathing. Another condition that these people usually have is anemia. People who have sickle cell anemia may have mild, moderate, or severe anemia most of the time. And symptoms include those of anemia: the fatigue, the pallor, the lower extremity and the upper extremity cold, and also they have trouble with breathing. Yeah? Sickle cell people can also suffer from stroke. Anyone who has sickle cell anemia is at risk of for stroke, including babies, and this is approximated up to 11%. So stroke will come with severe headache, trouble with speaking if this baby has already started speaking, trouble with walking, change in alertness, sudden weakness on one side of your body, or one side of the child's body, if it is the child, or if it is from an adult. We also have splenic sequestration. We also have splenic sequestration. This happens when sickle cell becomes stuck in the spleen, forcing your spleen to get larger. Splenic sequestrations often cause acute anemia, and symptoms may include pain and enlargement of the spleen. That is splenomegaly. This person is also at risk of getting bacterial infection, such as Streptococcus pneumoniae, Haemophilus influenza, Salmonella typhi, and this will present with fever, cough, trouble breathing, pain in the bones, and headache. Another bad condition that can usually happen to a sickle cell person is prepism. What is prepism? This, I want to say that it is about 35% of male people who are who have sickle cell anemia are the people who will develop this prepism. Prepism is a painful erection that lasts for hours. Painful erection that lasts for hours. And you get that when a person gets this painful erection that lasts for hours, it damages the red blood cells. It damages the blood vessels that supply the penis. And you get this person might suffer even from impotence. Another condition that is also very common with sickle cell people is leg ulcer or ulcer. When they get a wound, the wound don't heal easily, and they can suffer for this condition for the longest period of time. It is because of even low immunity, because their body cannot fight infection very well. They can also get pulmonary hypertension. Hypertension is high blood pressure. So they can get pulmonary hypertension, and the person will present with signs and symptoms of hypertension. They can also get chronic kidney diseases because of lack of enough blood supply to the kidney. They can also get retina damage. They might even get blind, or they can become blind because of the damage of the because of the damage of the blood vessels that supply the eyes. Yeah, that is why sometimes they can get blind. So let me talk about the diagnosis and test. How do healthcare providers diagnose sickle cell anemia? Healthcare providers diagnose sickle cell anemia by taking blood samples. They may use a technique called hemoglobin electrophoresis or high performance liquid chromatology. The test identifies and measures different types of hemoglobin in red blood cells, including the abnormal hemoglobin that causes sickle cell anemia. Maybe you are asking yourselves, what are the chances that your child may be born with sickle cell anemia? That depends on whether you and or your partner inherited the sickle cell anemia or have sickle cell trait. Sickle cell trait is not a disease. People with sickle cell trait have a mixture of normal and abnormal hemoglobin in their red blood cells. So they have enough normal hemoglobin in their red blood cells to prevent the cells from being sickles. However, they do have an increased risk of having children with sickle cell anemia. So if you or your partner both have sickle cell trait, your child might have higher chances of getting sickle cell anemia. So if you only have one, or let me say, if one of you has sickle cell trait, your child won't be born with sickle cell anemia, but there are 50% chances that your child will be born with sickle cell trait. Yeah? Did you get that? If one of you doesn't have the sickle cell trait, there is higher chances that you will not get a child with sickle cell anemia, but your child will be born with a sickle cell trait. Yeah? So studies estimated about 1 to 3 million people in United States carry sickle cell trait, including about 80% and 10% people who are black. Let us talk about prenatal screening. Healthcare provider can diagnose sickle cell anemia before your baby is born. They do this by taking a sample of biological mother amniotic fluid or tissue from the biological mother's placenta. Then they examine the samples for signs of sickle cell hemoglobin gene that causes the condition. So you will be prepared that you will give birth to a child who is having sickle cell anemia. Nothing much can be done at that point, but you will have to deal with the reality. So let us look at the management and treatment of sickle cell. Maybe you are asking yourself, can healthcare provider cure sickle cell anemia? Right now, there is stem cell transplantation or bone marrow transplantation that is said to be one of the best cure for sickle cell anemia. But there is disadvantage of that because there are a lot of complications after the transplant. There are a lot of maybe rejection after the transplant. So sometimes it cannot be successful. If maybe they do bone marrow transplant, the problem will be someone you can get the bone marrow from, the donor. It is very hard to get the donor. That is number one. And also, you might get the donor and the body reject the bone marrow. And also, there are some complications that may set in after the transplant, such as severe bleeding, infection, a lot of complications. You know, this is something that is critical, or this is a serious surgery. So there are a lot of complications that might set in. So how do healthcare providers treat sickle cell? Because there is no cure, but there is prevention of all the conditions that we have talked about. Healthcare provider typically treats sickle cell anemia with blood transfusion, not white blood cells, with blood transfusion, antibiotics for infection, and medication that reduce symptoms caused by sickle cell anemia complication. This medication may include hydroxyurea. They can include glutamine therapy, among others. How can I prevent sickle cell anemia? Sickle cell anemia is an inherited disorder. You cannot prevent it. You can have a blood test to find out if you have sickle cell trait that you could pass on your children. So people can have sickle cell trait without having sickle cell disease or sickle cell anemia. And you get that when one parent is having sickle cells, the chances of getting children with a sickle cell anemia is not higher as somebody who is both parents are somebody who, as from parents who are both of them are having sickle cell anemia or sickle cell trait. So how do you live with sickle cell anemia? You avoid the triggers. You use your medication. You go for regular medical checkup. You eat well. You drink a lot of water. You get in touch with your doctors. And then you will live healthy without any complications. Even if they will come not frequently. But right now, I can say people are living with sickle cell anemia and they are very healthy, and even you cannot tell if they are having the condition. I think I will stop from there. So let me just beg you, if you have not subscribed, kindly subscribe, like, share, comment. So bye till next time. If you have any condition that you want me to talk about, I will talk about if you write it on the comment section. So bye till next time.